Tanaiste, as part of the recent reconfiguration of Dublin hospitals, the emergency department at Loughlinstown was downgraded to a minor injuries unit and 24-hour care was stopped. Now, I and many others supported these changes because the clinicians leading the reconfiguration believed unanimously that it would save lives. The HSE gave us repeated assurances that St Vincent's would be given sufficient resources to absorb the extra workload from Loughlinstown Hospital. But Tanaiste, in spite of these assurances, the following letter appeared in the Irish Times from a registrar in St Vincent's. The real scandal at St Vincent's is the overwhelming increase in acute unwell patient volume since the effective closure of Loughlinstown to out-of-hours admissions. This has led to a doubling of medical and surgical admissions to an already stretched but otherwise efficient and well-run public hospitals. Clinicians of all grades and disciplines are working flat out to cope with the increased demand. So, Tanaiste, I followed up with clinicians in St Vincent's, and here's some of the things they said. They said ambulance arrivals are up about 50%, GP referrals to the emergency department are up about 50%, and overall admissions are up about 50%, and Tanaiste have doubled, they tell me, now in out of hours. They say that in spite of this, the emergency department has received no additional nurses and only a token complement of doctors. Just last week, Tanaiste, staff that were promised from Loughlinstown to St Vincent's have been pulled. So the emergency department in Loughlinstown is dealing with a 50% increase in volume with only a handful of extra medics, contrary to the assurances we were all given. That's not the only problem. St Vincent's hasn't been given the additional ward beds to deal with the additional volume either. Also, patients in Loughlinstown who get very sick are being referred directly to the ICU, the intensive care unit in St Vincent's, which is also bringing that to overcapacity according to the medical staff in the hospital. So not only is the emergency department working flat out, Tanaiste, but there's nowhere in the hospital for them to send the patients once they've stabilised them.
Thank you.
So what's the result? The end of the letter says this: the end result is an unsustainable, overcrowded and unsafe mess with significant compromise in delivery of care. Patients are suffering and some will die. But Tanaiste, this is outrageous.
Thank you, Deputy.
It's unacceptable to me, and I've no doubt it's unacceptable to you that this has happened. So my question is this: why have the additional resources, which we were promised would be put in place, not been put in place? And why has a situation been allowed to develop in St Vincent's Hospital in which clinicians in the hospital are now telling us is going to lead to patients in your constituency, in my constituency and many other places dying?
Thank you. Tanaiste.
Well, Deputy Donnelly, as you're aware, prior to these changes taking place between Loughlinstown Hospital and St Vincent's Hospital, I convened a number of meetings with the HSE and with the management of the two hospitals. And I invited you, as I did other deputies who had expressed to me an interest in this issue, because you didn't express any interest to me on the issue. You know, Deputy Boyd Barrett, your only interest. Your only interest, Deputy Boyd Barrett, is to stand outside the hospital with the picket. You have no interest. You have no interest. You have no interest whatever in solving the problem. We have, as you know, Deputy Donnelly. As you know, Deputy Donnelly, we convened those meetings to discuss with the managements of the HSE and of the hospital their plans in relation to these issues. I will arrange another meeting now, arising from what you've just read out here, and ask the managements of St Vincent's Hospital and Loughlinstown Hospital and the HSE to address the issues that you have raised here this morning, because, like you, I would share your concern if the service is not being adequately delivered. I'm a little surprised at the figure of an increase of 50% in ambulances, because, of course, prior to the changes in Loughlinstown, trauma cases for about a period of 2 years or more, in any event, had been going directly to St Vincent's Hospital. But these are issues that certainly I take seriously, and I'll ask the HSE and the hospital managements to meet with me again and discuss those issues.
Deputy Donnelly, 1 minute. Thank you.
Thank you, Tanaiste. Tanaiste, can I suggest to you, I appreciate your offer of setting up a meeting. Can I suggest that a meeting is probably not enough? Can I suggest at this stage, we have been given many assurances. We were given an assurance, I was given an assurance by the HSE that the combined budgets of the 3 hospitals involved, St Vincent's, Loughlinstown and St Michael's, would increase as part of the reconfiguration. I was then told a year later that actually not only would the budget not increase, it would decrease. We were given an awful lot of assurances around timing of when this would happen. Those assurances didn't come to pass. And now we have this extremely serious situation where a medical registrar and medical staff are saying people are going to die, and they are telling us that the assurances we have been given by the HSE
Could I have your supplementary question,
been met.
Please?
So, Tanaiste, can I suggest to you that a meeting is fine, but actually at this point, because these allegations are so serious, we need an independent and urgent review. Is the 50% correct? I don't know. Is ICU over capacity? I don't know. Are GPs referring? Is there a doubling of admissions out of hours? I don't know. We don't know. But what I think we need at this stage is an urgent independent review. So could I ask 2 things? As well as the meeting, which I thank you for offering, will you ask that an independent review is immediately commissioned and that we can get a report back on that? And will you commit that if this review finds that these allegations have substance and that the necessary resources have not been provided to St Vincent's, that this government will immediately provide them? Thank you.
Thank you.
Well, I think the first thing we have to do is to probe the facts and see what is the actual factual situation. I think maybe it might be a good idea to ask the registrar concerned to come and tell us directly and have the issue probed, the statements that he's making with the management of the hospitals. So I think the first thing we have to do is to establish what is the factual position, and then we'll set about resolving it. I think what we need, the outcome we want here, is that there is the highest level of service available to the public. You mentioned beds, for example. My understanding was that beds in Loughlinstown Hospital were to be used for elective situations and so on, which would in turn free up beds in St Vincent's, which would enable, the throughput of people through the accident and emergency service. You're aware that by the time the changes were made in Loughlinstown, the numbers actually attending at the accident and emergency ward in Loughlinstown were very, very small at night, because by that stage, most of for quite some time, the major, if there was an accident, for example, on the N11 somewhere, the accident case was brought directly to St Vincent's Hospital. So I'd like to probe the facts here a little to see what is the factual situation. We can do that, and if necessary, as I said, we can ask the registrar who has written about these matters to come and give us the information he has, and let's have it tested.
Thank you.